This is The Metro on WDET. I'm Sam Corey, sitting in for Robin Vincent. In America, we have a lot of very big problems. Climate change, income and wealth inequality, hyperpartisanship. How should we be tackling these problems? Paul Fleming is an associate professor of public health at the University of Michigan. He believes we need to focus more on preventing problems from occurring rather than simply responding to the next crisis. It's that mindset, detailed in his book, Imagine Doing Better, that he hopes will help us get to the root of the problems we seek to resolve. I recently spoke with him about that and more. We began by talking about why policy is important to focus on at all. A lot of folks find policy very boring. Why does it matter?
Yeah, great question. I think policy shapes our everyday lives, and I think that's something that we sometimes forget. I, too, have been at moments in my life where I find policy very boring, especially at the local level. It can be really minute, small things, but when you really pay attention, you realize that those small things matter. Zoning policy, for example, is an example of policy that I think is fairly boring, but when you actually dig into what zoning does within a community, it actually shapes what our neighborhoods look like. It shapes what resources are available. And so,
because it determines like what kind of housing can be built, where businesses can be and where industry can be.
Exactly. And when you think about your day-to-day life, that's shaping your life. You know, we're seeing right now where policies related to food stamps and SNAP benefits, right, that is impacting in a big way. And so policies really do shape our day-to-day. We don't always see it, but paying attention to policies and really thinking deeply about what policies we have is something that we all need to be doing.
Yeah. You write that in your book you didn't always realize how important policy is and how often it can actually hurt people and not help them. How did you come to realize that policy is really important and that particularly it can have negative effects?
I lived in a particular neighborhood in Atlanta that had pretty decent resources and had opportunities, but I did some work in a very poor neighborhood within Atlanta, and you could just see the ways in which that neighborhood did not have the same investments. So the people that were living and growing up in that neighborhood didn't have the same opportunities. And so when you look across sectors in terms of educational outcomes, who's graduating high school, who's becoming wealthy, who has jobs, you start to see patterns where actually where you live and grow up matter to those things. Some neighborhoods, some places have more opportunities, more investments, and others don't. And at the end of the day, that's really about our policies, both at the federal level, state level, and local level of the policies that shape those different opportunities.
Can you give me an example of that, of some of the policies that shaped a rich neighborhood in a particular way and a poor neighborhood in a particular way and what you saw in Atlanta?
I think sometimes what we see is for example, there's policies around environmental regulation or corporations, and that sometimes polluting companies can be placed right next to neighborhoods, and it has an impact on those people's health and those opportunities. And then there's fewer investments because there doesn't want to be restaurants and other things in that neighborhood where there's polluting corporations, right? And at the end of the day, it was policies that enabled or did not enable a corporation to exist in a certain place. And so I think those are the types of things that are shaping our neighborhoods in different ways.
Yeah, and poor neighborhoods are much more likely to have big polluters around them or in them than richer neighborhoods are.
Exactly, yeah.
You write about the public policy paradox. The way I understand it is when government is essentially creating a problem with policy and then is going and trying to fix the harms that it had caused with its policy. Where does the public policy paradox show up in your work in public health?
This paradox shows up in a lot of spaces. And when we look to the research, we see that there are a lot of different ways that things the government is doing is actually causing certain harm in neighborhoods. And then we also have a government response to that thing. I mean, one of the examples is we have studied again and again the ways in which our prison system and criminal legal system can have a negative impact on communities. So it impacts the health of people who are incarcerated, but then the research shows that actually if you're from a community where there's a lot of people that are incarcerated, you're more likely to have chronic diseases, poor mental health, right? So those things happen, and we actually spend billions of dollars sort of on the prison system to make that happen. But then we also ask our government agencies related to health to help address chronic diseases and help address mental health crises, right?
I spent a lot of time on your book thinking about this paradox, thinking about the public policy paradox. And I think the way I understand it from your perspective is that public policy is meant to resolve a particular problem. I guess I wonder what you make of the perspective that public policy has many different purposes. You talked about criminalization of people or putting people in the criminal justice system. We criminalize people for a reason, that people in power want to punish people who are doing harm to others. Honestly, I'm not even sure if you ask them, they necessarily always want to rehabilitate them. We try to clean up the environment by preventing the construction of homes in some cases, but that means while the environment is cleaner in some contexts, there are then fewer homes that are built, and that means that costs go up. And sometimes we're aware of that, and sometimes we're not. But I wonder what you make of that perspective that public policy, because it's run and operated by people, that means that it has aims of doing many different things, not just resolving one issue.
It's an interesting point, and I think that's part of what my book invites people to do is really zoom out and ask bigger questions about what is the type of society we want. When we focus in narrowly on these smaller questions, people often frame the issue or the policy choices as these kind of zero-sum trade-offs. And what I think we all need to do is collectively imagine what it can look like to think from a mindset where we are sharing resources rather than really always thinking in this place of, well, if these people get resources, then we need to deprive these other folks. That's the bigger picture that I think I try to write about in the book, that we need to step back from the day-to-day and get into this longer-term perspective and really think about what is the type of society we want to pass on to future generations.
Yeah, and in that perspective, in that light, you talk about adopting a preventative mindset of kind of breaking the policy paradox. Preventative medicine, for example, has become a lot more popular among doctors and medical professionals, at least from my perspective, over the last decade and a half or so. People seem to be a lot less focused on just solving an issue on the back end. They actually want to get in front of it, get people out, more active, doing healthier things. You, of course, work in public health. Talk about why this is so important from a public health perspective.
Yeah, from a public health perspective, we have kind of a story or an allegory that we often tell, which is about, there's somebody that approaches a river and they see someone drowning in the river and they jump in to save that person, right? And then all of a sudden there's another person they see drowning in the river. And they go and save that person. And then all of a sudden they sort of ask the question of like, well, why are so many people drowning in the river? What's happening upstream of the river, right? In public health, we think a lot about what we call upstream thinking, which is how do we actually prevent people from getting in the river and drowning in the first place, instead of pouring all of our resources into this place where we're rescuing people that are already drowning. And so that's really where the prevention mindset or the prevention thinking comes from, is instead of approaching problems after they already happen, how do we think about preventing them? Now, when we think about health, that's an easier place. We want to stop people from getting certain diseases or having certain accidents in the first place. That's the bread and butter of public health. And what I think prevention thinking more broadly can do is look at other areas of our society and other areas of public health and really ask the question of, how do we prevent harms from happening before they start?
This has me thinking, the public is very reactionary. And that is true now, particularly with technology speeding things up, with people being able to react to things much quicker. But it's kind of always true when there is a problem, when there's a crisis, when there's an issue. People look to politicians, representatives, public leaders to solve that issue now. And the thing that they want is that thing resolved. They are not necessarily thinking about the root of the problem, not because they're necessarily even short-term thinkers. They just need that problem resolved. What would you say to a politician who's like, yeah, I love this idea, but like crime is happening right now. Violence is happening right now. How do you suppose that I get to the root of this when like I need to stop this fire immediately?
Yeah, and I think that is a reality, right? There is a tension between the urgency of now. We all know there are some very real crises that we are facing in the current moment. And also, I think the short-sightedness of only addressing the right now without also thinking about how things will play out further into the future is really short-sighted. And ultimately, I think what we need to ask of our leaders is to really explain how the response and the investment that we're making in communities through our public policies, through our budgets, needs to have attention to not just the right now, but also to investing for the future. And I think that is a thing that we need leaders to really lead on. And so I hope that the policymaking, not just from our politicians, but our community leaders, those who are activists, those who are teachers, those who are working within their churches, really framing the conversation not just around the immediate need, but we have children in our world right now. We have future generations. And so how are we building towards a more sustainable future? Because we know that the short-sightedness that we're using right now for our policymaking has gotten us to the place that we're in right now, which for a lot of people is just not working.
I mean, in this sense, it makes me think that in order to lead well, in order to construct policy well, those people need to be talking to a lot of different folks to understand all of the possible ramifications of what they put down on paper.
Absolutely. I mean, I think one big part of this prevention thinking is that you are actually in relationship with other people in your community, understanding the needs, and then collaborating together towards a collective vision of where we need to be. And I actually think a lot of what we're seeing in the present moment is a lot of destruction or attacks on systems. And where we need to go is towards a collective vision for what is the community or the society that we want that is actually going to take care of each other in a way that is supportive, that promotes health, that promotes well-being and thriving, economic security, safety. And that isn't the way we do things right now. We are so reactive. And so it's going to take a concerted effort, and it's going to have to come from individual conversations within our communities to move to that point.
Yeah, being against something isn't enough. We have to be for something too.
Yeah, absolutely.
This is The Metro on WDET, Detroit Public Radio. I'm producer Sam Corey speaking with University of Michigan Associate Professor Paul Fleming. We're discussing his new book, Imagine Doing Better, which is about why people, particularly people drafting policies, should take a more preventative mindset. Tell me a little bit about how public health is changing, how people are looking at public health differently, and how you're trying to inject some of this preventative mindset into it.
So with the pandemic starting roughly 5 years ago, obviously that was a chaotic period in a lot of different ways across a lot of different sectors. Part of what it meant for public health was there were different movements that were both promoting distrust of public health, and then there were ways that public health institutions in some ways failed different communities during the pandemic. And so we're at a period where we're coming out of that, right? And we have now elected officials at the national level that are really antagonistic towards public health. Right. That means that they are cutting funding for public health, including public health research. So our public health institutions at the local level are struggling with that. At the same time, many of those public health institutions were trying to respond to a chaotic pandemic that they hadn't had to deal with previously, right? So there were some mistakes made, but there also, I think, were, in most cases, really good faith efforts that's actually trying to protect people and do their best. But where we're at today is a place where there is a lot of mistrust of public health institutions. And we're also in a place where the resources and funding for the work is much more uncertain than it ever has been. And so I think for our field and our public health institutions, we need to really focus on repairing trust, which actually connects pretty strongly with a theme in the book, which is we really need to be led on relationship-first efforts. So we really need to know and understand the people in our communities and have respect for them. So that means people who may have very different viewpoints from us, that there is a basic human dignity and relationship that we have with those people, and that there's kind of a common understanding. And so I think where we need to be emphasizing a lot of our effort in public health is getting to know folks within our community, stepping outside our bubbles, and then working together to craft policies, craft approaches that our institutions will take.
And how does that tie to getting to the root of issues, problems that people experience that fall under the public health realm?
Yeah, I think the more you talk with people and the more you have deep, trusting relationship with different community members, you understand exactly what they're facing. And, one of the key ways that you can get to the root cause of an issue is you really keep asking why, and you keep talking to people to understand what is at the root of what is going on. Of course, there is research also that you can turn to that shows what some of the root causes are. But at a fundamental way, it's true about communication, but it's true about everything. We can't just rely on bigger networks to solve the problems in our world. We need to take ownership of them. And it doesn't mean that we're solving them on our own, but there are ways and actions that we can take. That's part of what I write about in the last half of the book is the problems are large, but the steps we can take to solve them are small.
I think I want to close by talking about some of those steps because you try to lay it out, which is identify the root causes of a problem that we talked a little bit about, prioritize primary prevention, and focus prevention on what the impacted groups actually want and need. I think you've laid a lot of this out, but I wonder if there's an example in public health where you think this is going well.
When we see violence in communities, right, that's a huge societal problem. Nobody wants to live in communities where violence is prevalent. The sort of status quo way or the way that we, I think, as a society are trained to think about violence in communities is the response should be more police. Those police arrest the people who are perpetrating violence, and then those people that perpetrate violence are put in jail for years and years and years. A more public health approach or prevention thinking approach to that thinks about programs like violence interrupters. So these are evidence-based programs that we've seen in different communities, and they train folks who are well-connected in their community that can intervene before the violence even starts, right?
Detroit has community violence interventionists. Yeah.
Exactly. So that's a great example of it. The idea is that the investment that we make in our policies and our budgets happen at that point, right? We are funding violence interrupters so that nobody has to experience the violence in the first place. Now, the alternative, the status quo way that I talked about, right? Think about how costly that is. It's about $42,000 a year to keep somebody in prison. So that's an investment that we are already making on a very large scale in our society, choosing to spend that much money per person because they committed an act of violence. Now we're going to put them in jail for a certain number of years. If we switched up our thinking and instead thought about how do we invest in preventing that violence in the first place, I think we get to so much better outcomes. We prevent that person from having to be in jail. And when somebody's in jail, they're no longer able to contribute to their community, contribute to their family, etc. So we prevent that thing. We prevent the victim of the violence from being victimized. So that is a good thing. And ultimately, we get these better outcomes, and typically it costs less. And so there's a lot of wins there. I think part of the problem is, as a society, we sort of have been trained in this narrative that the way to solve violence is police and prisons. Yeah. And so we need to take this different approach. I think that's what prevention thinking invites us to do, and we can get to these different solutions.
I know we mentioned it earlier, but I think what this has me thinking is that preventative medicine, preventative thinking has this comprehensive look, which means that like somebody who works in public health is not just somebody who is an academic or some doctor or physician, but is also somebody who works in policing or somebody who works in schools or who works in other fields. What am I saying? There's a sort of interconnectedness that you're drawing out here. And if somebody has one role and one task, that doesn't mean that the impact of that is just in one sector. It bleeds over into everything else.
Yeah, absolutely. And I mean, it's something I share with my students, but there's a concept from our field called health in all policies. And the idea is that actually all of our public policies shape health in some way. It shapes people's opportunities in some way. That's something we touched on earlier. And to promote health does not mean that you have to work in the healthcare sector. In fact, a lot of folks in public health are working in our transportation department. They're working in the education system. They're working in different areas and sectors of society. So if we're thinking about thriving communities and thriving societies, it is certainly needs to be something that we think about across sectors. It's not just something we need to be thinking about in the healthcare world.
That was my conversation with Professor Paul Fleming. We spoke about his new book, Imagine Doing Better, Why Policies Backfire, and how prevention thinking can change everything. Coming up, gambling and addiction impacts all people from all walks of life. So what happens when gambling enters video games? And who is held responsible for protecting kids and young people? This is WDET FM, Detroit Public Radio, your connection to news, music, and conversation. And this is the Metro. Stay with us.